Medical rounds, diabetes, it is one of the most prevalent diseases in the U.S. And according to the American Diabetes Association, nearly 30 million Americans have it. Now, to help us better understand this disease and what it means for people who have it, we're joined right now by Dr. Michael LeMay, an endocrinologist at Hartford HealthCare. Good evening, Dr. LeMay. Thanks for being with us tonight.
Good evening.
First of all, let's clarify the difference between type 1 and type 2 diabetes.
Well, type 1 and type 2 diabetes are both chronic conditions that affect the metabolism of sugar in the body. Type 1 diabetes is when the patient loses the ability to make insulin, and so they have to inject it several times a day. They can't live without it. Type 2 diabetes, the patient makes insulin, it's just their body is not very good at utilizing it, so it's more of an insulin resistance.
All right, well, what are the symptoms of diabetes and how is it diagnosed? We often hear about thirst being a symptom.
Sure. Frequent urination is one of them, especially waking up in the middle of the night to urinate several times a day. And because they're urinating so much, certainly increased thirst is a byproduct of that. Blurred vision can happen. Unexplained changes in weight can cause both type 1 and type 2 diabetes. But sure, those are definitely common.
Is it possible, Dr. LeMay, to have diabetes and walk around and not know it?
Absolutely, and so it's a disease that is really silent in that patients may have it and not realize it, and so that's why they really need to see their clinician at least once a year so they can get screened for it, because uncontrolled diabetes can really wreak havoc in the body and cause all kinds of complications that you really don't want, like blindness, amputations, neuropathy, problems with the kidneys, things like that.
That's a good point. What are some of the treatment options available at Hartford HealthCare to help with both type 1 and type 2 patients?
Well, certainly type 1 diabetes, you need insulin, and within the last few years, several new insulins have come out that have a better profile, make it easier to get optimal control for those patients with type 1. In type 2 diabetes, certainly there's some things like Fitbit and apps that allow people to track their activity and their intake of food, which provides them to do better lifestyle-wise, and that's critically important for both type 1, but especially type 2 diabetes. But there are some other medications, both pills and shots for type 2, that have been great efficacy, great durability, and minimal side effects that have really helped out a lot.
Boy, that's great to hear. Thank you so much, Dr. LeMay, for sharing that great information with us tonight. Now, if you at home would like to learn more about this topic, you can call the information you see on the screen, the number you see on the screen. In the meantime, if you have a question for Dr. LeMay, you can ask him directly during a live discussion on the Hartford Hospital Facebook page, and that is happening right now.
When people say,